Welcome to the Healthcare Nation podcast. I'm your host, Rick Gannotta, and we're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the health sector. This is the Healthcare Nation podcast. Welcome to the Healthcare Nation podcast. Your host, Rick Gannotta, here with our producer, Joe Woolworth. Joe,
hello.
So great to see you. It's been a while since I've been in the studio,
welcome back,
man.
welcome back.
It's great. I'm so pleased to be here. We got a lot. Number one on the docket for today, but we got guests coming up with health policy, technology, gene therapy, the markets, lots of shows coming up in the next couple months for us to look forward to. But I'm excited to be here today. We got a crazy kind of framing of our topics today. I know we talked about this and we thought, let's talk about the four horsemen of health sector change. So what are your thoughts on that, Joe?
I mean, it doesn't paint a happy picture if that's kind of the analogy we're hunting for. But I mean, there's a lot going on. And I guess anytime there's a big change, there's fear that, oh no, it's all going to fall apart.
There is.
And I don't know that there's that many people that just are so in love with the way healthcare is working that there's not a little bit of like, oh, I kind of hope it falls apart so that something better can take its place.
Well, I think if you look at a $4 trillion opportunity and the transformative factors that are going to influence this moving forward, you know, our analogy to the four horsemen might be appropriate. I mean, there's no doubt things will not be the same when you're on the other side of it. But let's break down the horsemen, I guess, for lack of a better way to think it through. What do you think? Yeah.
So the first horse that we're talking about, the white horse conquest. Yeah. And choosing to go with demographic shifts to represent this.
Yeah. Listen, and I think we picked four for this show. Obviously, it could be an innumerable number, infinite, when you think about the challenges that are out there. But when I think about these four that we're looking at, specifically starting with demographic shifts, you know, if you think about this, it's focusing on the impact of population dynamics, obviously millennials, baby boomers, the impact that will have on driving changes, the velocity of that change from chronic disease management and the baby boomers to, I think, technological adoption with the millennials and the Gen Xs and Gen Zs.
Yeah. So on that note, with focusing on the millennials, like there's all this talk about the younger generation leaning into tech, but how is that shaping the future of healthcare consumption?
Oh, well, I'll tell you, I would say this. Across the board, when you think about adoption, if there's any driver across the board, I would say the millennials are absolutely leading the shift towards digital adoption across the board. We're going to talk about consumerism as well. But I would say the demand for efficiency, access, immediate access, the preference for telehealth, we know that's happening, how that's influencing the retail sector and how the markets are really taking advantage of that. And an APA, American Psychological Association data said that, look, when you look at preferences, the comfort level and the adoption rate the millennials have really undertaken with everything telehealth, telemedicine in that world, it's not going backwards. It is almost a preferred, at this point, mode of interaction with their clinicians.
Right. I mean, to get super stereotypical, normally people think of like younger people embracing technology, older people, not so much. I like to go to McDonald's every once in a while for breakfast, and it's funny to watch, like, it's pretty much anybody that you think is maybe over 65. They're like, I'm not using that kiosk. And they're like, sir, can you please use, I'm not using the kiosk.
Yeah. Yeah.
You know?
Hey, we saw this with banking, though, right? And it takes a while before you had the ATM adoption. I think that the consumerism piece with healthcare, it's going to get there. We're still, I think some of the friction that's in there is you want this more than a transactional relationship with your provider, particularly for the baby boomers, right? For the over 65. They grew up on that.
So how do you think what are the challenges then healthcare providers are facing when they're talking about this aging baby boomer population?
Yeah, I would say one thing, you know, probably the fastest growing demographic when you take a look at over 65, the influence that they're going to have on, I would say, the delivery side of the health sector moving up. Why? Because in general, we could say they'll live longer. That'll give you more chronic disease issues, chronic disease management, how we're going to tackle that with some of the things we'll talk about in a few, which is chronic clinician shortages. Along those lines, it's going to be difficult to, I think, meet the demand of this group. Right. In some very specific areas as well, I would say You look at chronic disease, obviously across the board, type 2 diabetes, congestive heart failure, the impact of obesity, how those really influence, I would think, an elderly or older growing population. But also, I would say when you think about orthopedics and joint replacements, et cetera, there's some areas that are going to have a real, increase in demand across the board.
What kind of impact do you think that this demographic shift is? How is it going to influence healthcare spending, economic planning?
Yeah, I would say this. There's going to be more resources applied to chronic disease management across the board. So talked about technology. So how will technology play a part in that with the baby boomers? It's going to. I think the adoption has been a little bit slower than we thought. But I would say that from a provider side, a hospital health system or even physician offices, allocating your budget effectively so that you know that you're going to have a population that's growing older, more on the chronic disease side, is probably a smart way to look at it across the board. When you look at the straight line economics, not that it's one of my favorite places to cite, but the World Health Organization believes that for aging populations are going to triple the cost of healthcare by 2050. So that's just kind of a straight line look at that economically from a global perspective. So the impact is really significant.
Yeah. I mean, when we're thinking about our analogy here, the four horsemen, it's not a happy picture.
Yeah.
It's kind of in the apocalypse, it ends in the destruction of all things.
But maybe a new start.
In this case, do you think this isn't part of the prep thing, so maybe we cut it, but I'm curious your thoughts. All the effort, all the numbers seem to be indicating that, like you just said, healthcare is going to triple. Chronic disease management is kind of like the future of it. Is there any effort going into chronic disease prevention?
Wow, that is, this is the age-old question, right? Sick care system versus one that's oriented towards keeping you well, right? I mean, and health care should be all about that. I'd like to think that with respect to, when you look at consumerism, consumer-centric approaches, agency over one's health, being able to Google and do a search on a particular condition is going to allow folks to have, a line of sight on taking care of themselves better than they have historically. At least to be armed with questions to ask their providers, right?
Sure.
We could agree on that. Whether the orientation, and we could look at our payment structure and say, we'll move completely to being incented to say, I have to keep you well in a value-based system, where I'm really looking at clinical outcomes, the quality of that experience, right, satisfaction, and the financial performance. We're slowly chipping away at that, but I think that's being influenced in a big part, obviously, by policies and this incredibly arcane system that we're trying to, again, create the, I'll stop short of saying apocalyptic change.
Sure. I like where you're going with that. I think one of the positive things about consumerism is that the consumer drives the demand. You think about there wasn't any organic food in Walmart 10 years ago. And then everybody started wanting to eat organic. And now Walmart's like the number one place to buy organic. And it's not because Walmart cared.
Right.
But that's what the consumer wanted. So I guess there's the sliver of hope there, right? If it goes towards consumer-based and the consumers educate themselves and they want to get out of that cycle of sick care and be into the wellness care, it could change.
Yeah, I would say in healthcare, it's what do you want, when do you want it, how do you want it delivered? And we're seeing this, and this is where the demographic, I think, really tells the tale. With millennials, Gen X's, I might want it now. I want it through some medium that I'm used to doing, right? I mean, obviously their phone, the app, a telehealth visit is a great example of that, but it doesn't start and stop there. There's no doubt about that.
So how is digital health technology meeting the needs of the younger healthcare consumers?
Yeah, I mean, as we just said, I think it aligns perfectly with their preferences. And obviously, with respect to your I think insights on consumerism, it's a perfect matchup across the board. We know this when we see development of apps, wearables, everything that's going into that space, the investment there across the board, the preferences that we mentioned. It is heading in that direction. It is the preferred choice for sure for the Gen Zs, millennials across the board.
Yeah, it's kind of interesting to think about the amount of data that, normally when you go to a doctor, one of the first things if they're trying to diagnose that, in my experience anyways, has been like, so what's been going on? There's that information gathering. But if you've been wearing a wearable for 2 years, there's just a plethora of information right there.
Yeah. And think downrange when you kind of meld together this retail experience and some of what I would say is the strategies that perhaps an Amazon would be deploying. Mm-hmm. So I have all the information on what you're buying and consuming at Whole Foods. And oh, by the way, I also know because you are getting your pharma delivered, your drugs through an Amazon either portal or logistics company, that what you might be taking for a prescription. And I overlay that with what you're, perhaps watching on TV. It kind of creates this avatar picture of you that arguably you could say, there's a lot of information you can glean from that. That could have a big influence on your healthcare. There's no doubt.
Yeah, and a lot of fear of like Big Brother stuff comes up when you're talking about that too.
Yeah.
I don't know if you're familiar with, there was this really interesting article about how Target got in trouble with information gathering. Are you familiar with this story?
No, bring us up to speed.
This was a couple of years back, but essentially, long and the short of it, what had happened was a mailer went out from Target based on information pulled from demographic stuff that basically let a young woman know that all of her prenatal needs could be met by Target. And the dad got this postcard and was very mad because he didn't feel his daughter was of the right age to be marketed this way. And it turns out, long story short, that the predictive data was correct. She was in fact pregnant, and Target knew before Dad.
Interesting. Just on the preferences of what the buying,
just on like how it changed from like, she now changed to a different kind of milk and this kind of stuff. The predictive marketing wing of Target was like, yep, pregnant.
Yeah, interesting. Well, hey, listen, we'll see more and more of that coming out, and that's why we felt secure in healthcare with HIPAA, guarding our privacy. But when you, bad way to characterize it, but when you bleed over into this retail kind of experience, and you have publicly available data or data that's gleaned from other sources that isn't protected the same way you are protecting it with health data, you open up an incredible, can of worms. There's no doubt about it. And that the vignette you just described is one of them across the board.
Will we be diagnosing ourselves based on the ads we see? Like, oh crap, maybe I got diabetes.
Could be. And we had two guests within the last 6 months, Brian Southwell, talking about trust and what we look at in information that we get from sources on the internet, et cetera. What is the real source of truth for healthcare information? And we had Judy Germano talking about cybersecurity and the incredible porous nature of what you're looking at with healthcare data. It's a scary story when you think about apocalyptic themes here.
a lot to be concerned about in there, I suppose. Yeah. Switching gears here, what technological advancements are proving most effective in managing those chronic diseases for older adults?
Yeah, I think, it's funny, the American Hospital Association and the American Heart Association did a lot of data on this behind the scenes. The AHA, in particular, the Heart Association, basically said readmissions for heart failure could be reduced by 50% if you have the correct wearable that's looking at oxygen saturation, heart rate, et cetera. That is significant. And let me riff on that for a second. If you think of a typical congestive heart failure patient can be readmitted in the hospital 3 or 4 times a year. If you could reduce that down by 50%, that is significant. Not only good for the patient, but from a cost savings, it's tremendous. So I think that's a nice little narrative that shows you the impact factor that you could have across the board with this. The other side is when you look at drug efficacy. So if I wrote a prescription for you, you start on a drug, you wanted to see whether it worked or not, I may not see you for 6 months. But the drug, and whether it makes a difference or not, we'd have that answer within 3. If there's some communication device that we could use to increase, again, the velocity of efficacious prescriptions, the right drug, the right patient, all of that, I think that would make a difference. And we'll see more of that coming through, I think, on the technology side, on the self-reported, from the patient perspective, to the clinician and then having some kind of decision matrix based on that. Now, whether that will be completely informed by AI or not is another question. And, we talk about that a lot here on the show. But that, I think, is something that we should look forward to with more of a positive inflection than a negative one.
Sure. I mean, that makes a lot of sense. And there's reasons to be hopeful if that adoption actually happens. What do you think are the barriers for the older generation? I'm just trying to think of some of the people in my family that I know that I'm like, hey, if you wear this wearable every day, you'll get this info, and then pass.
Yeah. We saw this years ago with just having things like Holter monitors on folks and how difficult it was to keep electrodes, stuck on the chest, et cetera. It's probably a lot more complex when you think about some of the advanced wearables. And maybe better described, it's just the familiarity with the interfaces that folks are using to, get online, communicate their particular diagnostic condition through some kind of an app. I think for all its complexity, it's getting simpler and simpler. I mean, I think that what you're seeing out there...
The battery times are getting better.
Battery times are better, and the convenience. I mean, if you could have a watch on that acquires, passively and actively information, if you have...
Those rings that now have like crazy long battery lives.
Ultimately, I think a vest they're having that will acquire tremendous amounts of parametric data. I think it'll get easier, and to your question, it'll get easier for folks who have a natural, let's just say, avoidance for interfacing with technology because of their age, because of other issues, because of even access to that. Yeah.
I mean, my mind goes right to like 1984 stuff with Big Brother. Like if I'm wearing this wearable and then I'm like, time to order some dinner, and I open up DoorDash and it's like not supported by a healthcare provider and you can't order what you want.
I think that falls into the category of the internet of my things and the internet of medical things. When that starts communicating in your house, in your
if Amazon gets involved in the way that they're talking about it, it's absolutely going to happen. They'll be like, your healthcare provider does not support, like I can see like a whole new thing coming in, like, I would love Snickers, and they're like, Snickers not suggested to you based on your profile.
Right. Well, if you were prescribed a particular diet and it was managed for you, by having prompts, nudges.
See, some of that I would like, because I still honestly don't understand what the heck gluten is. So if someone could just tell me when it's got gluten in it, it would be nice to be like, that's against the policy, but the nagging side of it, I think people would have a real hard time with.
I think it's heading in that direction now. Yeah. And how you'll be prompted or not will be very personal, specific, and as much as we think about population health, I think that technology is going to allow us to get into a level of personalized medicine that we had never really thought of before.
Yeah. Well, continuing on our metaphor with Horsemen of the Apocalypse, I suppose the last one, death, kind of the analogy here is clinician shortages.
Yeah.
Like what happens when there's no employees to support the system? And I think there's been a ton of talk in AI. I don't know if you've been watching some of the talks, some of them funny, satirical, about how I saw one, I think it was on John Oliver, or maybe it was Bill Maher, but the idea was they put together all these clips of people saying that AI wasn't labor replacement. And then they would slip up and be like, but it kind of is. It's like, it's not meant to be labor replacement, but it will.
Yeah.
And the people designing it are like, it's great for laborers, but it's going to take their jobs. Just that kind of juxtaposition, like, is it, won't it? And so the AI plays into that. But then I think in the healthcare industry, numbers were dwindling far before AI was a thing. So how is technology facilitating better outcomes amidst this clinician shortage?
Yeah, let's look at the shortages in the aggregate. I'll focus in on physicians and nurses specifically here. So I think a physician shortage over the next 10 years will be pushing 80,000 different specialties, right? This is significant across the board. There's no doubt about that. And medical education's got to address this. The way we train physicians, new physicians, I think is got to be looked at when you're looking at meeting that demand. Also, other providers, nurse practitioners, physician assistants, how they could fill the gap, augment. But I think to your point on technology, and we'll stay on that for a second, I do think there's such an incredible amount of redundant, let's just say, paperwork, whether you're inputting it into a electronic health record or not, that could be avoided with the leveraging of technology, specifically artificial intelligence and the right kind of programmed algorithms that follow care paths, and you're attesting to whether you really are keeping the patient on that path or not. This, I think, has the promise of not only making care better because you're more consistent, but also taking away all those tasks that right now are wasting a physician's time across the board, and nurses as well. So I see that happening. On the more direct care side, when we look on the nursing focused perhaps area of this discussion, I would say, look, caring for a patient who is in the hospital, say in intensive care, et cetera, in which they need that level of, eyes on you, one-on-one attention in some critical care settings, is going to be tough to replace across the board. And I do think, in fact, I did a piece on LinkedIn over this past month that will probably leverage a combination of technology, a different type of provider, like a more advanced nurse's assistant coming in that will do a lot of the bedside tasks. And what you do is you'll have your professional nurses, your RNs and advanced practice nurses overseeing perhaps a cohort of patients in a given ward or unit. Mm-hmm. The ratios will be nothing like what we historically are thinking about, say, one nurse for 4 patients. It might be one nurse overseeing, let's just say 12 patients, but what they're overseeing is changes in their data, their physiologic status, all of the, I think, parametric data that goes into whether the patient is improving or declining, and then they're going to be coordinating care versus perhaps giving direct care. And it's almost a little bit back to the future if you look at nursing models. I mean, there were nursing models where if you go back 30 years, there was a medication nurse for the day. There was a nurse who really just changed all the dressings, and then there was the bedside nurse. We could see a little bit of that, but the task will be reallocated. It might, in fact, Joe, be the only way we're able to, create a situation where we have care delivery continuing in a rational way, and again, leveraging technology for the better. So,
yeah, I'm curious if the role changes from providing care to coordinating care, who's doing the care?
Yeah. And again, I would say this. Think about sending patients home sooner, right? So who delivers care in that setting? It's family members, right? Mm-hmm. That's for the most part, it's family members, maybe augmented by visiting nurses or some sort of a clinician service that comes up. We are moving in that direction. You could arguably say, hey, that's like cost shifting to a home environment. Certainly a lot less expensive. Yeah. But the bright side of it is usually you have better clinical outcomes as well. So you do better when you're home, which is a really good thing.
That's great if you have a diagnosis and a plan.
Yes.
But it would be really scary to be like, we're just going to send you home and we'll just keep working on the diagnosis.
Yeah. Listen, you got to have that in there. There's no doubt about it. That's why I think when you look at the shortages, particularly in the physician side, it is a big number, and we're going to have to figure that out.
Yeah.
I think technology is great and AI is great, but it's not going to be able to change the human element. That, number one, goes into not only having a caring, compassionate conversation, but really cognitively thinking through and ruling out conditions, and maybe having that supported by AI would be great. But I think it's going to be a while before that's completely supplanted.
Earlier, you were talking about maybe going back to more specialized roles. Yeah. So how severe is the projected shortage of specialized physicians, and what impact could that have on patient care?
Yeah, I think the numbers are over the next 10 years somewhere around 80,000 across the board. I stand to be corrected on that, but it is a very large number. And of course, in that, you have to remember that there are specialists, there are primary care docs, there are different areas that, because of the way our system is designed, if you have a shortage of, let's just say, cardiologists, that's number one, not a good thing. But then if you look at how they're distributed across the country, there could be some rural areas which are completely without certain specialties, which could really be tough on those populations. So that's something to consider when we look at care delivery across the board.
Specifically nursing here. In what ways are nursing shortages affecting hospital operations and patient care?
Yeah, I'll tell you, this is when you look at organized labor, say states like in cities like New York, Chicago, California, markets where they have unions, and those unions say you're going to have a nurse-patient ratio that is absolutely, this is it, it's codified, this is what you have to follow. It's going to be tough to meet those requirements across the board. And what will that mean? Might have to shut down nursing units, right? You may have to create other workarounds that aren't very pleasant. Obviously, in dire straits, you're going to probably extend the ratios there. But it's not a pretty picture when you look at the shortages across the board. And I think that in the nursing world, looking at nursing education, look at why nurses are leaving, look at the average nurse right now is pushing 50 years old. So retiring, there's got to be something that has to be done in that professional world.
And if the responsibilities of a nurse goes from, anywhere from 5 patients up to 12, that can't possibly be more enticing for people entering the nursing field. Be like,
yeah. But think of it this: if you framed it as a nurse as the care traffic controller, right? Really coordinating the direct provision of care in a hospital for a large number of patients, but not necessarily doing any hands-on care. Mm-hmm. That's a role change. And I think that's something that nursing education is going to have to grapple with if they're going to effectively leverage technology, but at the same time, think about new models of care which are going to be sustainable in the future. Yeah. And overlay that with education requirements, folks retiring, just the baby boomer population. I mean, I'd like to see, staying on our theme, maybe not the apocalyptic side of this, but maybe the opportunity side, even from an investment perspective.
All right, on to the next main topic here, payment models. We're using the black horse of the apocalypse, famine, here to talk about this one. So let's jump in.
Declining reimbursement, yeah.
Let's jump in here. I'll rapid fire some questions. What are the advantages and challenges of the growing prevalence of Medicare Advantage plans?
Yeah, I'll tell you, MA plans, if you take a look across the board, they've increased by over 10% just in the last 10 years. And I think there's data out there that suggests it'll be well over 50%, probably 60% in another 10 years of the total Medicare opportunity. Most of them will be Medicare Advantage. There are some states right now that have tremendous percentage of Medicare Advantage. Florida is a great example of that. And there are other states and markets that have high MA penetration. Why is this so attractive? If you take a look across the board, one, I would say there's a push for this, right? It's aligned incentives with both the government pushing folks towards MA with incentives, et cetera, but also when you look at commercial payers who are really administering these plans, there is a big upside for them economically if they do it right, and the way that the reimbursement is calculated in that, the star ratings, et cetera. So there's a big upside to this. For the consumer, for the individual who's covered, the patient, and we could say, for lack of a better way to describe it, it's pretty compelling if you could look at your Medicare spend that you're out of pocket going down to, in some cases, zero, but you also get vision and dental. Wow, that's something that's not covered in traditional Medicare. Now, what's the trade-off? You have to stay within a particular network, only use a particular hospital. It is perhaps geographically limiting. But for some folks, that works well. My prediction, increased adoption of MA plans, and ultimately, for young people like yourself, you may not have a choice except for Medicare Advantage in the future.
So how about the expansion of Medicaid under the ACA impacting healthcare providers?
Yeah, Medicaid, I'll tell you, look at states right now with expansion of Medicaid and Medicaid rolls across the board. This is something that 10 years ago, I would say, and certainly with Obamacare, I didn't think myself that we'd see the level of change and adoption across the board. There's a lot of factors in there, economic, et cetera.
Right.
I think Medicaid, first of all, it will continue to expand across the board, driven by lots of different factors. There will be new and novel ways of folks tackling, the challenges with Medicaid, the less than optimal reimbursement for services delivered, some of the limitations that you have with at the state level getting reimbursement from the federal government, et cetera, along those lines. But I think Medicaid, there's a story here that is bright, and a lot of folks will obviously benefit from being covered, but I think there'll be new opportunity to innovate in the Medicaid space. It's not going away. This is a reality. When you take a look at the total population of the U.S., say 330 million people, half are covered by some government scheme, whether it's Medicare or Medicaid. So along those lines, it is something that we will continue to innovate on, and I think it will, particularly during tough times, grow.
Quick story before my next question. Had some water damage, and it looked like it was going to exceed from a insurance standpoint more than I wanted to pay out of pocket. So we called our insurance guy, and he's a great guy. And he was like, "Hey, just tell him you're paying cash because you'll get a different price than when they bill us."
Interesting. Yeah.
Just like it was well-known information, not even surprising. So it kind of leads into this question. How do you think healthcare providers are adapting to the shift towards more government-sponsored health insurance?
Yeah, it's
Is it something silly like that? All of a sudden, it's like it's a lot more expensive now since the government's paying.
Yeah, I think that along these lines, the government, if you take a look at Medicare or Medicaid, and you look at let's just say hospital charges, they're never covering 100% of the cost of care. That's why there's cost shifting, using commercial payers to really make up the difference for, say, a Medicare or Medicaid population in the healthcare clinical setting. Now, that's not to say on the outpatient side and in the clinic side that you cannot optimize it. You can. And as I suggested earlier, I think there's a bright side to this, particularly managed Medicaid and managed Medicare, which we're seeing in MA plans. That is, I think, something to be optimistic about. Hospitals will still struggle in this. But you're right. When you look at what the government is, on the hook for, and you're basically guaranteed to get something, it may not be what you want, but you're going to get something.
Yeah.
Folks can make that work for them. There's no doubt about that. I think that's what we're seeing, certainly with the expansion of Medicaid.
So how do you think that the rise in healthcare consumerism is influencing the relationship between patients and providers?
Yeah, I think that more expectations, this really goes back to our conversation on the millennials and the Gen Xers, and just younger expectations across the board. It will be, I want my care now, I want access to information, I want transparency, and I want it in a way that is comfortable for me, that works for me.
Right.
And there's a lot of, I think, comparisons with retail experiences and consumerism in healthcare. There's a group that would say, nah, it's not relatable. There's a big group that says, oh, yes, it is. I'm in the camp that says, absolutely. I think the expectations across the board, particularly when you think about what you're expecting from a provider, wouldn't be any difference than what you're expecting from your plumber and your water damage, right? I mean, it's the same thing. You're particularly in the payment for goods and services, or the payment for, I want a diagnosis, or I have a cold and I want a prescription, or, fix my broken ankle.
Right. So what role do you think technology plays in this evolving landscape of healthcare consumerism?
Yeah, it'll play more and more, and we're seeing this. Our conversation on Amazon, I think, is an insight, obviously, along those lines, and what we're looking forward to in the future. It's going to be the enablement through, technology apps to get that information, to get that appointment, to have a synchronous, real-time, or asynchronous, off-time conversation with the provider to get a prescription. We know that's happening right now. Companies like Roman and Hims, just out there, Teladoc, clearly were the early companies that were taking advantage of this. More to come on this, without a doubt, and I think the market will respond.
Yeah. So if you're a healthcare provider, maybe you have a practice, I think of it like I remember the story of when Netflix tried to basically sell itself to Blockbuster, and Blockbuster just laughed them out of the room.
Yeah.
They're like, you got nothing. And then the market changed.
Yeah.
And Blockbuster's gone. And Netflix is worth a crazy amount of money.
They are. Yeah. Think about it. That was true disruption across the board.
Yeah.
You know?
And if consumerism has that similar level of disruption in the healthcare industry, what can these practices, healthcare providers, be doing now to prepare?
Yeah, I'm not saying completely adopt a retail mindset, but being more customer focused, right? Consumer centricity. Knowing that folks are going to come to your office armed with lots of information and probably questions is a good place to start.
Yeah, but instead of being annoyed by it, like,
right.
oh, these WebMD people coming in,
yep.
they think they know everything.
With their little file, yeah. But the other thing is, what can they deploy right now so that they have a competitive advantage over the next person with respect to, is there technology? Is there, if you don't have telemed, you should deploy it. If you're not fully, engaged in some sort of proactive communication with your patient population, with the panel that you serve, you probably run the risk of losing them, right? So I think the upside of this is like subscription models we have out there, where you could really look at something new and innovative, and to your earlier point, maybe bend the curve in the right direction towards keeping people healthy.
And I think you could say, I don't want to do that. But you run the risk of somebody else is going to do it.
Someone's going to do it.
And it's probably going to be somebody like Amazon.
Yeah.
Which I think most people would agree, like the bigger the company, the worse the customer service.
Yeah. Well, I think, but if you get how many Amazon packages do you get delivered a week? Think about that.
I totally understand. Like, I got strange feelings about Amazon, but it doesn't mean I'm not going to order something off it today.
Yeah.
Like, are they a monopoly? I think they probably are.
Yeah.
And it's probably bad for business, but I'm still ordering stuff. Like, I got this weird relationship with Amazon.
And it's funny when you think about the monopoly side, and we see this also, I'd say, with the development of AI tools in healthcare. You don't want a small group creating something that so many will be dependent upon, right? I mean, particularly one which can make a clinical decision on an individual's health and the trajectory of their health, right? That's a loaded proposition when you think it through. That's why competition is so important, and the innovation side. And again, I go back to this. We are seeing that happen, and it's in the private sector. There's no doubt about it. So, is there a tech renaissance in healthcare? I think it's probably one of the only places, where there really will be that kind of, wow, this is a complete game changer from one decade to the next.
Yeah, and there's already people that are kind of leading the way. Like, you got your hims and your hers.
Right.
And, it's basically fill out an online form and you can speak with a doctor and get a recommendation.
That's right. And it's easy. You're never even seeing the doctor, right?
Yeah.
I mean, that's the other thing. Which
that's
is
a great example of just 100% consumer focused.
Yep.
Like, they run ads like their Airbnb. They meet a need. It doesn't even feel prescription or medical.
Doesn't, right? And when the barriers for reimbursement and what you pay out of pocket versus what's covered, when that gets changed in that equation, right? In these consumer, then you're going to see really incredible rapid adoption across the board.
So we started out, we got our 4 horsemen here.
Yeah.
The first one, the white horse conquest, we were talking about demographic shifts.
Yeah.
Secondly, we were talking about technology advancements. We chose to use the horse of war to represent that. We got the payment model, famine. We've got clinician shortages. We're talking about death. We didn't paint a very happy picture.
Yeah.
What's your final thoughts on all this?
Yeah, let me break them. I think the demographic shifts, let's think about the changing population dynamics, right? It's going to influence demand. It's going to influence service delivery when you think about that. I would say that with respect to knowing and understanding your customer, right, your patient, the reality that a millennial and a Gen Z and a baby boomer absolutely have different preferences is going to be important if you're going to be successful running a hospital or health system, or if you're in a med tech startup. There's no doubt about it. Demograph's going to have that kind of influence. So when we think apocalyptically in the change, know this, because if you don't, it's at your own peril. when you think about the technology side, we've gone over this so much on the show: AI, wearables, just the adoption of technology, but also things like gene therapy, CRISPR, et cetera. These are game changers that are going to be revolutionary. And it really will, I think, over the next, let's say, 10 to 20 years, create opportunities for disease mitigation that we never thought possible in the world of oncology, even rare diseases along those lines, which I think is tremendous. Payment model evolution, right? This is the real dark horse when you think about it. That's considered a work in progress, and we know a couple things. One is the government covering about half of all Americans, right? If you think about 330 million. The rest, when you look at self-insured, employer groups, commercial insurance, always undergoing change with the value-based care equation. There's no doubt about that. I think understanding how you get paid, making a rational choice with how you're going to deliver services, there is some upsides here. We talked about Medicaid. I think Medicaid and optimizing Medicaid in some innovative and new different ways is going to be something that a lot of folks are going to figure out. We see that at the state level where it is starting now, I think, to make an incredible difference. More people are covered, very innovative approaches. It's a good story. And lastly, the clinician shortage. This is something I think is ultimately going to drive new models of care. Shortages of clinicians, physicians, nurses, and other areas. But I think leveraging technology and having technology augment that gap is going to revolutionize the way we have direct care delivery. It'll look different in the hospital setting, and it'll look a lot different when you think about the home setting.
Yeah.
Because we haven't really done that at home at scale. And that is something we'll see evolve over the next 10 years.
Yeah, which is exciting to think about. I think there's certain things that you would rather do at home, but there's still certain things you'd rather be in the hospital for.
Yeah, certain things, the hospital's never going to go away, right? I mean, you'll need the level of critical care to take care of highly acute patients. But there's so much that could be done out of hospital, outpatient settings, offices, and then ultimately, in the home with some episodic communication that is real time. Let's just say synchronous through some telemedicine connection, but also home visits. So I think there's a good story there as well. The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.